in the life cycle of academia, we are excited, at the same time sad that we are successfully graduating a group of residents from each departments as they go on and pursue their different advanced milestones and pursue their dreams, while we welcome new interns. This is also the concluding HPP session on well-being for this academic year. And as we were planning this session, I want to thank or rather, sorry, Ms. Judd and Ms. Scott sort of for guiding us and helping us collect the data, which you all sent throughout the year, and what were the common themes that were still prevalent that needed addressing and what has already been addressed. And then, of course, we couldn't have done this without the resident leadership through the Resident Leadership Committee and Advisory Board, and led by Dr. Okereke, who is currently a senior resident in internal medicine, going to be chief resident soon, and is also the chair of the Resident Advisory Board as it relates to well-being and for the whole house staff, actually. So thank you, Tina. Last year, I first want to say that if it was a year or a time that called us to be resilient and take care of ourselves and others, I think it really tested every limit. And I think I just want to say thank you. We have been able to show and or rather showcase not to just ourselves, but our colleagues, that we indeed can pivot as needed. From the GME standpoint, we couldn't have done it without the input from each of you. We used the model that we had developed, looking at the Maslow's hierarchy of needs and whether that was providing food with the support of Dean Shack and Dr. Four and the GME leadership to residents after hours when we were surging with cases during the COVID pandemic, or whether it was supporting the White Coats for Black Lives during June, actually just this time last year. We continued to focus on the issues that we were working on. Communication was a big one that we continue to work on and have made headway with the help of Dr. Adams, Dr. Screws, and the whole IT team. And while providing skills training, especially around taking care of COVID, donning and doffing PPE that Dr. Davis from the Department of Medicine helped us with, Dr. Sethi and Dr. Sizemore. So I can keep on and on about that, but just wanted to say thank you. As we move and plan the year forward, we wanted to just highlight a few areas. I'm going to start by welcoming Mr. Holland. He is going to give us a brief update on the Employee Assistant Program through CIGNA, which is a change for us moving forward. Pam, do you want to give us a brief introduction on Mr. Holland, please? And welcome,
yes.
Jerry.
Thank you.
Yes, ma'am. Many of you will recall meeting Jerry Holland at our various orientations. Jerry has been a partner with the university and our graduate medical education programs for as long as I can remember, and I can remember a long time. Jerry Holland is the leader of the Holland Insurance Agency located just outside Memphis and manages the health insurance, including hospitalization, prescriptions, vision, and dental insurance for our residents. And our current provider is CIGNA. And so he is our liaison with CIGNA. So whenever you or our office have an issue with trying to get something from CIGNA, Jerry and his staff have always been wonderful to help us, and we certainly appreciate that. And now that CIGNA is going to be providing our employee assistance program for the residents, Jerry agreed to give you just an overview of what the new employee assistance program looks like. It is replacing the current E&I NexGen Total Wellbeing Program. Jerry, I'll leave it to you. Thank you.
All right, thank you. Thank you. As Pam said, I'm Jerry Holland with Holland Insurance, and I appreciate you all allowing me to speak to you for a few moments today about our new EAP program that will begin July the 1st. I am going to share my screen at this time and try to, there we go. Bear with me. All right. So hopefully that has popped up. So what I would like to do today is just make you familiar with the benefits that you'll have under the new EAP program. As Pam mentioned, it is underwritten by CIGNA. CIGNA as well provides our medical, dental, and vision benefits. So this is a nice addition to that. It is good to have these all in one place, and you'll see how they kind of work together as we go through this. So we'll just get started. A couple of things I want to make you aware of. Regardless of whether you take the CIGNA benefits for your medical insurance, all residents will have this benefit. So regardless of anything else, each person will be covered by the EAP and have the same level of benefits. Okay. So I've got some information here, phone number and contact information, how to reach CIGNA and their EAP department. We're going to talk about this information in different spots, but anyway, you'll have a toll-free number that you can call. You can also use the website at mycigna.com, and you'll need to enter your employer ID, which is UTGME. So for those who are not familiar with an EAP, EAP is an employee assistance program. It is a benefit that is paid by the employer. It's no cost at all to you, and it does include all of your family members. So regardless of whether your family members are on the balance of your benefits. So all residents and their dependents will be covered by the plan. EAP is here to help you with a number of issues, from family problems, alcohol and drug abuse, stress, legal questions, financial questions that you may have. There is a lot that is part of this program. It is useful. It works hand in hand with the other benefits that you have. This is in addition to your medical benefits, not instead of your medical benefits. Under the medical program that we have, we do cover behavioral health issues, other service. Now, there's no on the limits on the number of visit sessions that you can take advantage of, and more benefits than you would have just with the medicals. So some of the benefits of the EAP would be face-to-face counseling sessions. You can have 3 face-to-face counseling sessions per issue, per member per year. So if you had met with a counselor for an ongoing issue, used your visits, you had something else that came up that was different, you could start over again with 3 more visits. Now, telephone consultation, there is no limit. So it's unlimited. Again, no cost to you. If you've used your 3 visits, they'll guide you and help you understand that maybe you need to turn to the medical side to continue further with that, or maybe just use the telephone consultation benefits, as that is unlimited. These benefits are available 24 hours a day. That phone line is always manned 24 hours a day, 7 days a week. Where we say here that it's a household benefit, that means that all members of your household are covered by the plan and have the exact same benefits that you have. So we're going to talk in more depth about some of the services here that are mentioned, the work-life support, such as child care and pet care. I'll tell you how that works, financial services, legal services, and identity theft services, all are part of the EAP program. So, sometimes if you've relocated and you're in a new area, child care is a big deal for everyone with children. And if you're not familiar with child care services that are available to you, you can simply pick up the phone, call the EAP department. They will actually send you a list of daycare centers that are in your area. It'll tell you how far they are, if there are any ratings that they can provide, reviews. They'll help you find a number of daycare centers to choose from. We know that some folks that we've talked to within CIGNA that have this themselves have had very good luck with the daycare option there. They can talk to you if you need assistance with adoption, if you need assistance, prenatal classes, what have you, all available. Senior care, if you're helping to take care of a parent, or if you have a parent that lives with you, the same would apply. They'll help you find support for the needs that your seniors have, and will help you identify where you can get that. Education is just part of that child care situation. They'll give you information on kindergarten, public schools in your area, college programs that are available in your area, as well as pet care services. They'll help you find what you need, whether it be training for your pet or a veterinarian in your area. So again, there's a lot to this, and I just hope that you will remember that it is available to you, and take advantage of these benefits. Identity theft. If you have a situation that has occurred, they can counsel with you, help you figure out how to manage that situation. If you haven't had a problem with identity theft, but you're concerned and would like some information on how to prevent that, they will meet with you online or on the phone and give you instructions and help on keeping yourself safe from identity theft. So financial considerations and legal considerations, managing your debt, budgeting strategies, retirement planning. They've got 25% off tax preparation here, so they can guide you if you need a tax preparer to those that they're familiar with and help you get a discount. Same for legal services. They can help you with a lot of legal services. If you don't have a will, they will help you prepare that will. It costs you nothing. If you've got a dispute with your landlord or a tenant, they have experts that you can be in touch with to give you advice. Family law as well can help you start the process of adoption. If you'd like to do that, they can tell you step by step how to go about getting that done and achieving that. So financial and legal services, remember that you have that. MyCIGNA.com is the website that we're going to talk about a lot, not just for the EAP, but here soon when we have the orientation meetings for your other benefits. MyCIGNA.com is the one spot that you're going to want to be familiar with. You go to MyCIGNA.com and register. Then when you return to that site, everything there will be pertaining to you specifically. The provider directory that would be listed there will be the one for your area. It'll be the provider directory that you need to look for. So whether you take the medical benefits or not, register yourself at mycigna.com so that you can find more information on your EAP benefits, as well as find the directories that you need. There are a lot of articles available there. There are seminars that we'll talk about that you can participate in. The self-assessment tools are very good. I always say with regard to myCIGNA.com, if you have the medical benefits, if you go to myCIGNA.com for one reason, that would be to download your ID cards. So we all seem to have our phones with us just about all the time. As long as you have your phone, then you'll have your ID card, and all of the information that's available at CIGNA.com is available through their app as well that you can download to your phone. So you'll find it to be a very easy to use site, easy to follow, a lot of good information there. If you've got a claim that's been filed, it will be listed. It will tell you what your responsibility is. Of course, under the EAP benefits, everything would be paid. You won't have any out-of-pocket expense. So you can do virtual counseling. So basically like the Zoom meeting that we're having, you can meet with a counselor. You can use your smartphone, your tablet, your computer, whatever you'd like in order to have that visit. It costs you nothing. Now, we do, again, have behavioral health benefits under the medical. If you're participating in that, you would want to use your EAP benefits first. You won't have a copay. If you are using your medical benefits to see a counselor, you would have a $25 copay. So definitely use the EAP first. All of the CIGNA reps will know that you have the EAP and will try to help guide you to use your benefits in the most effective way. So telephone sessions, they're unlimited. So you can do as many as you would like with that. So again, the phone number is listed here. All of this that we're looking at, let me get off track just a little bit and let you know that when you register for your medical benefits and make your elections for the year that you're going to choose, whether you choose to take medical benefits or not, you're going to go to a portal that we're going to discuss in your next orientation. The site is it's called Bernie Portal. And anything that we feel like you might like to refer to, we will have posted on the portal. So all this information will be on the portal. You'll have access to the portal anytime, whether you choose to take the medical benefits or waive, you'll still have a Bernie Portal account. And you'll be getting more information about that. But if you're needing these numbers or information, just remember you can always contact our office and we will email you this information, or you can go to that Bernie Portal. You'll have your own account there, and we will list everything that we think might be important to you there. So mentioned that they do have seminars on a monthly basis that you can take part in. It is a different topic each month. You can find those previous seminars that have been held. If you find a topic that you're interested in, those are always available for you to view at any time. So the behavioral health seminars could be on autism, substance abuse, children's behavioral issues. Again, CIGNA.com, you'll find these seminars and information on how to participate. All right, so we've discussed most of this already, but again, remember that you have the financial and legal as well as a referral system that's available for your child care, senior care. Take advantage of it. They're very good benefits. A lot of programs, stress management, family and relationships. These are things that we all face and may need help with from time to time. So that is the purpose of the EAP benefits. And we'll try to keep you aware periodically with reminders that you have these benefits. So anytime that you have a question, if you're unsure whether this situation that you're facing is part of the EAP program or not, don't hesitate to call. CIGNA's people do a very good job for us. We have very few problems with CIGNA. Occasionally, you may have a situation where you might talk to CIGNA and you might get off the phone and go, well, you know what, I don't understand, or I disagree with whatever they're telling me. Remember that we are here for you as an agency, and we're always available to help you. I don't think you'll have any issues when you call CIGNA. Let them know what you need. They'll help you. They do a good job for us, but don't forget that we are here for you as well.
Jerry, I think your screen is frozen.
Yes, I think so. While we get that resolved, are there any questions? And I think it just wanted to let you all know that we can work on trying to see how we can get this information on a badge buddy or as a QR code for you all. You know, you do have a lot of resources that are available, especially if you look at the emotional and mental and behavioral health counseling. Between the EAP and the LifeBridge, you have quite a few free options that you can avail of. So I think Mr. Holland may be having some problems with his, oh, there he's back on. Yeah. Thank you very much, Jerry. Are there any questions for Mr. Holland? This information was really to make you aware again that these resources are available. I know these are given to you at orientation, which seems very distant for quite a few of you, and we're going to try to make sure that we remind you on a regular basis that these are available. And readily, you know, if you don't have the number or the information, we can always point you to our website where this will be available, where Kim and Pam have done an amazing job to update that, and also how we can try to make it available as a badge buddy. So Mr. Holland, thank you very much for your presentation. With that, I'm going to turn it over to Dr. Screws.
Can you guys see my slides?
Yes. Now
Okay, cool.
we can. Yeah.
Just have a few slides, and because it always does the wrong window here, I'm just going to click through them. So this is sort of where we're at with current secure chat implementation. This is when we installed in April for all users end to end. This is when we started doing Rover for nursing and non-professional, non-provider. This is when we started to build out groups for children's. The next step would be, so the orange issues would be future kind of workflows. We do have opt-in groups, which is for peds pulmonary nurses. There's a few other groups like this, but basically members opt in and opt out either in Hyperspace or in the mobile application. This is good for clinic nurses, volunteers, surgical team. Provider care teams are also an option. We have peds pulmonary right now, so you can send a message to everybody on the team at once. Sign-in groups, This is using the same workflow that a lot of residents, some hospitalists, most bedded unit nursing follow. So they sign in as part of their normal workflow in Epic. And that makes a group. And then we can send like right now, you could send a message to the Ped Charge ED nurse. That follows a sign-in workflow. An on-call group we'll go over next, but these sign-in workflows really work through the treatment team. So most of your residents realize that you can hover over the storyboard on the left side of Epic to get to the treatment team. Then you can click in, and right now you can send a message directly from there to the users that are signed in. If a charge nurse is not signed in, then you wouldn't be able to send a message to a charge RN role. So making sure people are using the treatment team to sign in and sign out is important. Also, if you start to get secure chat messages after your shift is over, especially for nursing, it may be because they didn't sign out or sign in appropriately. This is the way the treatment team looks before the chat button was added. Currently, you'll see that if you look at the treatment team now, next to each of these roles, there's a little chat button where you can message directly from them. On-call scheduler, right now we only have Peds Pulmonary, but we're about to have 3 more on the Peds side as part of the pilot. This is an activity in Epic where you can, similar to Am I On, except it's right inside Epic, you can build your schedule based on the dates. You can do first call, second call, several different options and roles, and you can put in notes and create recurrent shifts. On-call finder is the viewable part of that. So this is like Am I On? Would have anyone have access to this, and so you can go into Epic under this activity, and you can see on May 14th that the pediatric pulmonary provider is Dr. Ledbetter. You could chat directly with him, shows you the hours he's covering. And you could search for teams or search for specialties, but that's the only one there at the moment. Push notification alerts. When we went live with Haiku a couple of years ago, more and more alerts started to be a problem. So a lot of people have turned off their push notifications, especially attending physicians, less so our resident colleagues. You do get a single alarm and then a reminder alarm, so 2 alarms. You can choose the sound. Right now, we're not using urgent notifications, but there's some, that's like priority messaging with Tiger, but we will be using that some for like STEMI and stroke and rapid response when we get to those. One nice thing I like about Secure Chat is this is the hyperspace or desktop version. You can really easily change your availability and put in notes like, you know, I am in lectures today, or I'm in the OR under your status, and that displays easily to everyone. There's a new feature that's not shown here as of 3 Sundays ago, which is you can change the availability for other users, like if they're scrubbed in or busy, you could change their status to busy and put in a message for them, or you could forward a message from them to you, like if you're a surgery resident and you're attending the scrubbed in, you could change their availability to busy in OR and change you to the person that the messages get forwarded to. This is the auto forwarding feature that we talked about, but the newer thing is that you can change that for other users. Availability, there's some automatic parts of the workflow right now. There's more automatic workflow that's being added, especially for surgery workflows. So when an OR nurse signs in a provider to the case, which is not always happening appropriately, signing the individual doctor into and out of the case, it'll change that status to busy in OR, BEH, or CH. If the provider is timed out of the case, which this is a part that doesn't happen as often as it should, that busy status goes back to neutral. Unavailable status does not prevent users from getting messages, but at least it shows other people that you're unavailable. There is a 4th status. It's actually not do not disturb. It's called offline. That'll probably be next year, but you could set your status to offline and you cannot receive messages. Just a couple more slides. Push notifications. So I've shared this tip sheet A lot of people get too many notifications, but really we're not using the workflows for any of the other ones. There's critical labs, there's patient messages, there's staff messages. Really, I would recommend that you turn all of those off except the chat message. There's 4 different chat messages, but one of them says chat message. The other one's about changing availability. You could choose if you wanted to keep those or not. Right now, all users can send message from one person to another. Everyone that has Haiku can also access secure chat. These 2 groups are the first kind of pilot. Peds Pullman has an on-call role in the providers I showed you. The Ped 5700 is, for those of you not on the pediatrics, that's our admission resident, and the Peds Hospice on call is the admitting hospitalist. So all of those have groups, and then sign-in groups we have for the unit clerk and the children's ED, charge nurse and the children's ED, charge nurse on the floor. And in flight, right now we're building out some groups for EROC because they send 1/5 of all the messages in TigerText. So we're trying out some groups with them after meeting last week. These are not live yet. And Children's Oncology, we're building an on-call group from them. And after a meeting today, we're building an on-call group for the PICU. And Rover for nursing. So Environmental Services had Rover. This is the mobile device application for non-providers. So like Haiku, it's tools you need from Epic on the go. But we've expanded that to nursing, especially in the children's hospital, but also some other high volume nursing leadership roles have asked for it, like house supervisors, things like that. So they can use it. Right now, it's really the light version of it, but we're using it as the vehicle to have mobile communication to replace Tiger. So this is just the nursing application, but also occupational therapy, respiratory therapy, basically anybody that wouldn't use the physician or nurse practitioner tools of Haiku. So we do have that license. We can give that to more people, even if they're not in the pilot. Last 2 slides, and I'll answer any questions that you have. Here's some barriers that we've come across so far. There's really 0.3 of a team member that is able to build and maintain these groups. Really meeting with the operational groups has moved at the same pace to establish which groups they need as the build, but that's a potential slowdown as if we suddenly need 30 groups built, that we don't have enough IT staff to do that quickly. Treatment team workflows are not universal. So you may come across, you try to send the bedside nurse a message and it's the one from yesterday or the one from last night, or you try to get in touch with a consultant and they're on the treatment team, but they're not the current person to talk with. Sign-in workflows are used pretty heavily. We have a report that shows the areas where they're used the most, but there's still some charge nurses that don't sign in as charge nurse, or they're doing bedside care and charge nurse, and it's a little bit different workflow. So the sign-in roles that we talked about for charge nurse and others won't work if they're not signed into that role. You just wouldn't see them. Rover is new to nursing, so getting nurses onto a mobile application requires some discussion and education and a little bit of IT, but it's new. And the sell for them has been that it has lots of other tools that they really like. So eventually we'll add flow sheet documentation, barcode, medication administration. So that's the carrot. And actually a lot of nurses use Tiger and they want to communicate back with the residents, but they didn't know that they have an option, and now they do. Login, so it's just having a discussion about this. You can use biometrics for 24 hours with Haiku, and as of today with Rover, to bypass the login. But with Tiger, you use your phone password and you can log in forever. That's not compliant, and actually we're going to apply a PIN code to Tiger. It won't be as stringent as Haiku, but that's a common complaint that I'm aware of, that I can just jump into Tiger quickly and answer a message. But to do Haiku, I have to enter either my Face ID, but I've got a face mask on. So I realize it's a stumbling block. But Tiger has been unfettered unnecessarily, and just comparing the two, has been difficult, but Tiger will be a little more restricted as far as access in the next couple of weeks. And then Wi-Fi, I actually have heard from several people that they didn't get Tiger messages and they did get secure chat Haiku messages, which I thought it would be the other. But either way, if we're using a communication method other than our old school pagers, we need to make sure that the Wi-Fi backbone is current and it's 11 years old. So that's still in the budget for the next capital budget, unless there was a huge change in the number. It was like 1.8 million, but suddenly that's changed to 3 times that amount, then there may be a problem. But that's a need for all of our Internet of Things and medical devices that communicate, not just Haiku and Rover. But that upgrade's still high level and should still be there. And then this is just a reference slide, some of the differences between Tiger Connect and Secure Chat. And I can share this slides with everybody. So enough discussion. What questions do we have?
Any questions from the residents or faculty?
Dr. Screws and Dr. Panda, this is Pam. I have a question about Rover. Is that since coordinators for the residency program are not providers, would it be helpful if coordinators had access to Rover?
Sure, that's not a problem. So the coordinators, are they administrative or do they have nursing background?
Most of them are administrative background. Okay.
Okay.
Just like Ashley Thurston in the pediatric department, each program has a person.
Haiku would probably be more appropriate.
Okay.
Even though she's not a provider or nurse practitioner, it actually doesn't matter. There are lots of tools for both mobile applications, and we're just using one of those tools. So for an individual like that, but we can give secure chat only. So I don't think Ashley has access to Epic, but we can give her a secure chat only profile where she can access it on either application. And since Haiku's secure chat is like right there in your face, and with Rover, you have to go into a menu.
Okay.
So if I were equal with those, and nurses could use Haiku, and doctors could use Rover. It's just the documentation tools for your clinical skill sets are meant for one versus the other. But probably for Ashley and other coordinators, probably would offer them Haiku.
I'm just thinking, I don't think the coordinators are communicating about patient care at all. So there's not a PHI, problem. But still, if we are trying to leave pagers in the background and eventually, since they're not HIPAA compliant anyway, and they don't always work everywhere, it just makes sense to me that if something would not cost the hospital a great deal of money, that we just need a good way for our coordinators to be able to get messages to residents. Okay.
Mm-hmm.
Okay. I can talk with you more offline. I just wondered
Sure.
if that's something. If Haiku.
And since we're,
Mm-hmm.
So I would then we should go ahead and add Ashley to the pilot, since we're trying to get a density in children's first. That would make sense since we're focusing on the PEDS residents using it. We could just do a proof of concept with Ashley being added, and then she could make a group.
Okay.
But we can explore that. Sure, we can find a couple of different ways. She also could use Emergent Wireless if there's no PHI, and she could send that, and we can route wireless pages to their individual phone numbers, and the only person that has that phone number saved is like Mike McKeever.
Yes.
He's not going to share that with anyone.
That's what we're planning on doing. We still have surgery, plastic surgery, and OBGYN who want to continue to use the individual pagers. Everybody else is going to be listed through their cell phones, but nobody has their phone number except for Mike, so it doesn't display.
Okay.
And then they have pagers for the different services. Okay. A lot of the departments are using those. Okay.
But for administrative discussions, especially if if it needs to be instant, that's the question, because this is an instant messaging,
Yes.
whether it's secure or not, we can give secure chat basically to anybody. So
Okay.
with Tiger, we're restricted by licenses. Even if they give us all of the licenses by signing again with them, we still, that's only for Erlanger employees probably. So if we wanted to extend it to non-employed and outside office or administrative staff, then that was a limitation. So we have that with Haiku, but Ashley's employed, of course. But just as an example, if an external person that happened to run the residency that wasn't employed, we couldn't as easily give them Tiger, but we could with secure chat.
Okay,
So
well,
I think the issue is we're trying to address how can coordinators have communication access to residents. I think that is the issue. And there are two things here. One, we could pilot with the PEDS program, but I think this may be further, discussion with either at the Wellbeing Task Force or the Resident Advisory Board. Why don't we put that as an agenda item, Pam? And I think when you have your coordinators meeting, you can ask their input too. In the interim, we can sort of pilot it with Ashley and see. But I think in the interest of time, you bring up a good point. Let's move on to the next, if there are any other questions. Is that okay, Pam?
Absolutely. Thank you very much.
That we won't be able to solve it today. That's
No,
why.
no,
But it's
I
a good point.
understand.
Thank you. Are there any other questions regarding communication?
I had a quick questions, Dr. Screws. I know in the past residents have brought up the possibility of maybe having phones, like even starting off with like on-call seniors, for the team having a cell phone dedicated for like communication stuff. Is that something that could happen, or are we still going to be sticking with the Epic Communication, Tiger Connect, and things of that nature?
So you're saying there's a need for voice calls?
Just having like a dedicated cell phone for like on-call, starting at least with on-call teams, like, if you're the admitting senior on call or whatever.
Right. So if you're the admitting person, then we'd have an on-call role for secure chat, and you could send a message that way.
I think the issue
having a dedicated number. I'm sorry, go ahead.
Sorry, Jeremy. I think Tima, thank you for bringing that up. I think I've heard some concerns also in the past, and that may be referring to what you are saying, Tina. Please clarify if not. I think the using personal cell phones and the expense related with that, just not just for communication via secure chat or Haiku, but in general work related, and that issue has been brought up in the past. Does your question relate to that, Tina?
It does.
So, I mean, you'll have to talk with Mr. Maloney about that, because he is not extending any more shared devices. In fact, they're cutting back on the shared devices for all roles. So I think that expanding that for residents or nursing roles is and that's not me at all. That's I'm involved in those discussions because I'm trying to find solutions and technology, but like the environment where they'll pay for more phones is going away. And so they're strongly pushing for a bring your own device from the top to the bottom. And I think residents would be at the top, not the bottom, because you guys run this show. But I think that whatever case you make would be great, because you need a business, you need a patient safety, you need a quality case to make. So for the phones that have stayed, that the case that has been made. But if it's because you want to get in touch with a role, or if it's because, so secure chat and TigerText should use very little data, and especially if you're connected to the wireless, if we can get better wireless, then you shouldn't use any data. If residents don't have phones, shared devices, I guess, could be an option, but we'll still have pagers, and that's just that's just what has been discussed in these other meetings. Is really for every role is to not give more shared phones. I can see the point, but that you'd have to make a patient safety or quality of care business case for it, would be the angle to get more shared devices.
Thank you, Jeremy. I think, and thank you, Tina, you bring up a very good point, both of you. If you have any data that other stakeholders have used to make the case, because I agree, this is more than just financial case for the users. It's a business case for the organization as a whole when it comes to maintaining efficiency of practice, patient care, safety, and things like that, and in-time communication. So if you already have some information that you could share with us, that's great. And then I will also speak with Dr. Shack and Dr. Four to see how UT can advocate this on the behalf of the residents and the faculty. So thank you.
You're welcome.
Dr. Four and Dr. Shack, do you have any thoughts on that or any questions?
Dr. Panda, I thought it was fairly straightforward and well presented by Dr. Cruz. I think, if we just listen to what he said and follow his instructions, we'll be okay.
Yeah,
I agree. I have nothing to add, Dr. Panda.
Yeah, and I think what we can do then is we can put together some information on how to make a case on behalf of the residents and the faculty to see how we can support at least and make the case. Now, whether they agree to it or not is going to be a different question. So thank you.
Dr. Panda, can I ask you a question? What is the case you're making for us to give each residency program a service line phone like PEDS already does?
So either it is the ask has been across the spectrum, a personal device, which is then returned at the end of training to a departmental, to a service line. So I think we'll have to see what that is. And that's why I asked Dr. Cruz to share some data with us. If PEDS service line already has that, then we can look into that as a model.
Yeah, they've had that ever since I've been here for over 5 years. And I'm not sure that that creates any less work for them for a service phone to be existent, just on my experience. The PEDS residents are on here, but I do worry that if you're going to advocate that they buy everyone a personal phone, that we don't have any budget offsets from what happens with the money you're already allocating to them.
Absolutely. And I think we also have to see what's happening in UT campuses across the state. So this is not, I mean, this is just a question. This is a town hall for a question and answer discussion. We definitely have to look into it more in detail and clarify our ask based on what we identify as the true need and then the possibility.
Yeah, and I get the town hall. I just know that out of these meetings, sometimes there's requests sent. So if Dr. Shack and Dr. Ford could circle back with the PDs before we do anything formally, I think that'd be good too.
Thank you. Yes. With that, the next item, I'm going to hand it over to Tina, and I see Ms. Rohde here also. Thank you so much, Mary, for joining us. And Tina, you can take charge of the meeting now from the residents' perspective. Thank you.
Thanks, Dr. Panda. For those who don't know me, I'm Tina. I'm a third-year internal medicine resident. So we wanted to have this town hall today, kind of like towards the end of the year, but more importantly, to bring up any concerns that the residents may have. And I've spoken with some residents, and of course, the biggest things usually kind of relate to food in terms of options. The biggest concern, and at the Residency Advisory Board meeting last week, is that we appreciate having the on-spot dining for after hours. However, our meal cards aren't working with the machines. So at this point, residents still don't have access to food after 8 o'clock when the cafeteria closes. And so just trying to figure out, any options for residents who are working here at night, since unfortunately at this time, we're not able to use the on-spot dining. So that's been a big concern is, what options will be available for residents. I know one concern was brought up was, whether or not the cafeteria is planning on bringing back the hot dinner line. I know for a while they were having hot meals and where they normally have that hot lunch, and whether or not that would be the option or if just the grill would be in the refrigerated sandwiches. So I know the biggest thing, and I'm glad Ms. Rohde is able to be on the call today. So that was the biggest thing is, determining, food options for residents, especially if we're at that point where we're not able to extend the hours to pre-COVID time. So what options are available for residents? And a suggestion that another resident brought up is maybe doing, once a year or once or twice a year, having like a resident appreciation day or something. Just little tidbits like that, just to kind of help with well-being and morale and, see if that's an option for residents. So with that, I invite any other suggestions. You can message me privately on here. or, feel free to chime in if you have any other questions or concerns that you'd like to bring up. But I know from the residents that I've talked to, the biggest thing is access to food, especially after hours, especially with the on-spot dining not working.
So are we tossing it to me?
Yes, thank you, Mary. Thank you.
Hey, y'all, this is Mary. Well, thanks for the feedback. First, on the spot dining, I don't know why the cards aren't working. They should be working. So that will be my first call to Dave to find out why and to get that fixed, because that is the solution for the 24/7 access to food. Unfortunately, we are not going to reopen the cafe past current operating hours today. So it's going to still remain 6:30 to 9 on Monday through Friday and 6:30 to 8 p.m. on the weekends. So I'll check on that, and then I can, I'll send back a message to find out what the solution is or what the problem is, because that should be working, because the credit cards are working and the payroll deducts are working. So I'm not sure why those swipes aren't working. They should be. And it's been widely successful so far since we've opened the on-the-spot dining. So the sales are there, and we're actually getting ready. We're building out the second location, I think next week, and hopefully we'll have a end of June launch in the adult emergency room, waiting room. So that's going to be the second location that will be added. And like I said, we're hoping to get that launched in a couple of weeks. But on the second thing that you talked about was the hotline. Actually, right now the hotline is open. The grill is closed because we lost our grill cook. And so obviously, I think everybody here knows and has seen on the news, we're in a national crisis for staffing, right? So we did have to pivot because we did lose our grill cooks to some local companies that are paying a different wage or a higher wage than we are. So we unfortunately lost some talent. So it was easier for us to open the hotline. So the hotline is open, I think, I want to say 5:30 to 9 p.m. And then Subway is still open. Simply to Go is still open. And then of course we always have hot soup. Until the closing hours. Chick-fil-A closes at 2 right now because, again, staffing shortages. So we had to make some modifications to the Chick-fil-A hours of operation, because Chick-fil-A is probably one of our most intensive venues we have in labor intensive venues we have in the cafe. So the hotline is open. Whether that's going to stay open or the grill cook remains open, we're having some discussions about that, and we're looking at how people are utilizing the hotline right now versus how they utilize the grill. So I'm going to let the data kind of drive the decision on that, of how people buy and how they're utilizing that hotline. So and then regarding Appreciation Day, I think that we'd have to figure that out, how that would be funded. I mean, I'm happy to do it. It's just how would it be funded?
Thank you, Mary. I think that would be a discussion that we will have with the leadership at GME here at Chattanooga, and then we'll circle back. I've not had that discussion yet, so I'd like to have that discussion with Dean Shack, Dr. Four, and others first before we have any more details. But thank you for bringing up that suggestion.
Sure. Give me today. I'll get with you by tomorrow about why the cards aren't working, and try to get those activated as quickly as possible. Okay.
Thank you, Mary. I appreciate it. You've always been very prompt at responding. Thank you.
Any other concerns? Anything else from the resident team?
Those were the main suggestions that I heard, Mary. Thank you for looking into that. I know having access, whether it's late at night, being able just at least grab a snack or coffee. So I think that'd be the biggest concern at this time, since the hours aren't able to be extended, is making sure that residents have access to something late at night when they're working.
Yeah, sure enough. And stay tuned on the second location for on the spot. So when we get your cards working, we will have that second location, and we probably will fill that second location up with a different variety so that we have a different menu mix at both locations. Okay.
Thank you.
Mary, is there a possibility that there will eventually be a third on-spot dining in the children's hospital?
Right now, Pam, there's no plans to
Okay.
do a third location yet, and that's really just because of funding on the capital piece on building those out. We'll see what happens with the capital next year that's approved. I'm actually Sodexo's had funded both of these capital projects, and I'm actually out of money with these last two projects.
Yes,
So
ma'am.
unless I get more money from Sodexo, but it's something we definitely will discuss because we do want to get a location in the children's hospital somewhere. So we'll
Okay.
think about that. It might be in the Masood building. We're not quite sure, but we'd like to get a third location. What's really going to determine that is how well this ED location does. Okay.
Yes, ma'am. Okay. No, I understand. Thank you very much. Okay.
Thanks.
All right. Thanks, Joe.
And even though your meal cards aren't working, if you have a debit card or a credit card, I checked it out because I don't have a meal card.
Yeah, the debit
And-
card and credit cards are
and
working.
it does work. Okay.
Yeah, and so is the payroll deduct. So I'm not sure why resident cards aren't working. So let me,
Okay,
I'm not
okay, they're not on Erlanger payroll, neither am I. So
yeah,
our
but what I'm
badges-
saying is the technology's already in place. So, and it's all
I
linked.
believe you. Yes, I believe you.
So, and
But you
Elizabeth
can-
Boston is my IT person that takes over that stuff. So she's the expert. So we'll get on this and get this fixed immediately. Okay.
No, I appreciate it.
Thank you, Mary. In the interest of time, I just have one more item since we have some students, or at least one that I recognize. Just want to let you all know that we now have your student lounge space identified and furnished. What we were waiting for were the computers and a printer, and that has been installed with the programs installed on them. And we are waiting for some artwork, and we should be having an open house for you all. I know you waited long for a space for your own where you can sort of unwind and work and I think it's been about 10 months since, or more than almost a year now, that we want to thank all the residents and the departments for accommodating the students in your lounge spaces. So thank you for that. And the students on the team, you will have an open house shortly. We'll keep you posted. So with 1 minute left, are there any other issues from the residents or your leader, Tina? There is one comment on healthy options on the on-spot dining. I'm sorry, personally, I have not used it, but I know that Mary has been open to healthy choices, and we will continue to monitor that and give her feedback. I'm sure she'll be happy to take that. So keep us posted, those members on the Resident Advisory Board. Anything else from anybody? It's 1 o'clock, and Tina, I'm going to let you have the last word.
No, I just want to say thank you to everyone who, came to the meeting. Thank you, Dr. Schack and Dr. Ford and Dr. Screws for being here. And also Mary, I know she's not on the call anymore, but I really appreciate that. And, like I said, if you guys have any questions, feel free to email me. And then I'll be sure to relay it to Dr. Pando or whoever, needs to see those emails. So I appreciate you guys being here and providing me some feedback, for this meeting. And I hope you guys have a great day.
Thank you all. Thanks a lot. And congratulations to all the graduating residents on the call today. We really appreciate each of you.
Amen.